Introduction. Asthma is a common chronic disease worldwide affecting up to 26 million people in the US alone, of which 7 million are children. The pathophysiology of asthma can be quite complex, but generally it involves three things, which are airflow inflammation, obstruction of airflow through the airways, and hyperresponsive bronchi. With asthma patients, they tend to suffer excessive mucus production and airway edema resulting in wheezing, coughing, restlessness, and chest tightness. Epidemiology. In the US, up to 26 million people suffer from asthma, 7 million of which are children. However, the WHO estimates that up to 300 million individuals worldwide suffer with asthma. Equally, up to 250,000 deaths from asthma are recorded worldwide. It is more common in male than female, with the ratio of 2:1. Risk factors. The most common risk factor for an asthmatic attack is exposure to environmental allergens such as dust, pollens, chemicals, and so on. Asthma can also be hereditary if a first-degree relative, such as the parent, is a known asthmatic patient. Certain ethnic groups also have a higher risk of developing asthma, such as the African Americans and also the Hispanics.
Asthma is a broad term for an individual with airway inflammation, which leads to two main results. The first is hyperresponsiveness, which means that the lungs are more prone to react to an irritant and to react more strongly to it. These irritants can range from breathing in pollution, which adds carbon dioxide to the lungs, to fog, which simply hinders the individual's ability to remove carbon dioxide. Either way, these irritants cause a more acidic environment. Secondly, repeated episodes of this hyperresponsiveness will result in airway remodeling. Airway remodeling will cause the airway to have a greater amount of smooth muscle present around the bronchioles and an increased amount of mucus, which will also be present. The cause of the greater amount of smooth muscle is debated as both muscle contraction and muscle hypertrophy as possibilities. pH is a very important indicator for asthma and has been shown to drop dramatically just before an asthma attack. This sudden drop in pH and the exposure of the airway to an acidic environment causes a reflux in the body. This reflux is what is referred to as an asthma attack. As a result of this environment, coughing, bronchoconstriction, hyperreactivity, increased mucus, and nitric oxide is the result. The production of this nitric oxide is why higher levels of the gas can signal to doctors a diagnosis of asthma. The specific mechanism by which asthma proceeds involves changes in blood pH levels, resulting in respiratory acidosis. When an individual with asthma is having an asthma attack, their airway constricts and swells, making it harder for them to breathe. This results in a decrease of oxygen entering their lungs. A lack of oxygen allows their bodies to build up CO2. An increase in CO2 levels in the body means that more carbon dioxide is available to combine with water to form carbonic acid. This carbonic acid dissociates into bicarbonate and H plus protons. The accumulation of H plus protons in the blood is what leads to a decrease in pH, causing the respiratory acidosis. pH levels in an asthmatic individual can best show a causational relationship just before an attack. For example, just before an episode, individuals with asthma in one study saw their pH levels drop over 100-fold compared to baseline. The researchers also noted that this is likely why steroid medications can be used and are successful in treating asthma patients, with the goal of raising their pH. This drop in pH immediately preceded other chemical reaction metrics they were tracking, including nitric oxide. Ultimately, these components of pH, bronchoconstriction, hyperreactivity, and increased mucus cause a decrease in the radius of the airway and an increase in the work needed to breathe. These are responsible for all the symptoms of asthma that will very often require treatment. Given this, a decrease in strength of exhalation, inhalation, and airflow are all ways in which asthma can be diagnosed.
In a normal bronchial airway, there is little resistance to the incoming air. The bronchial airway also has components that help trap dirt particles. These components are cilia and goblet cells, which work together to rid the bronchial airway of these particles. The goblet cells produces mucus to trap the dirt, and the cilia pushes the mucus up and out of the bronchial airway. Persons with asthma have a noticeably different bronchial airway. The bronchial airways are inflamed and could easily fall susceptible to irritation from outside triggers such as pollen. This causes for goblet cells in the bronchiole to overproduce mucus, mast cells to narrow the airway, and histamine to cause inflammation. Some signs of asthma include wheezing sounds and throat tightness. A physician can help determine wheezing sounds with the use of a stethoscope and also test how fast you can breathe out with a device called a spirometry. Asthma consists of inflammation and increased production of sticky secretions in the bronchial airway tubes. Symptoms usually occur when the airways tighten, inflame, or fill with mucus. Symptoms can vary from person to person, but some common symptoms include coughing, wheezing, shortness of breath, and chest tightness, pressure, or pain. These symptoms can be triggered by various irritants such as dust mites, pollen, infection, and smoke, just to name a few. These common irritants can cause a person with asthma to have an inflamed bronchial airway, and with the stimulant of irritants, such as pollen or smoke, could cause the body to release histamine, which results in inflammation and overproduction of mucus. These factors could further lead to an asthmatic attack by restricting the incoming air. Signs of a severe asthmatic attack include difficulty breathing, confusion, a rapid pulse, and sweating. Trouble breathing could lead to a cyanotic face or lips, or in other words, cause for the lips or face to turn blue. Medical attention is required if a person experiences any of these severe symptoms.
There are many different ways to diagnose asthma. Physical exams usually take place where the doctor will look at the patient's eyes, ears, nose, throat, chest, and lungs. And if the doctor thinks the patient has asthma, more lung functioning tests may take place, such as spirometry, peak airflow, FeNO tests, and provocation tests. In a spirometry test, the test is used to diagnose patients with asthma who are 5 years or older. The test consists of patients taking in a deep breath and forcing an exhale into a tube that is connected to a spirometer. This test helps to determine how well the lungs are functioning by measuring the amount of air being inhaled and exhaled. A peak airflow test. The peak airflow meters is a device that measures how smoothly and consistently air flows out of one's lungs. Because the airways narrow during asthma attacks, flow meters help measure and predict narrowing of airways moments before an asthma symptoms start occurring. This could be hours or days beforehand. One must place a meter in between the mouth, between the teeth, taking in a deep breath, followed by a hard and fast exhale. The numbers given by the meter can determine whether or not the asthma is under control. Peak flow meter is so sensitive to the point where it can detect changes in airways before a stethoscope can. Peak flow meters can help determine whether to increase or decrease medication, decide when it's to start seeking emergency care, and identify any asthma symptoms triggers. Tests, also known as exhaled nitric oxide. These tests can help measure airway inflammation. A FeNO test measures the amount of nitric oxide in one's breathing. as well as help tell if and how much inflammation is occurring in your airways. During this test, a patient blows into a plastic mouthpiece or a tube connected to a monitor. The patient takes a deep breath in with their mouth open and little by little exhale until lungs are without air. The reading will show on the monitor that is connected. Knowing FeNO levels can help determine what type of asthma a person may have, tracking airway inflammation, if the current treatment the patient is receiving is helping, and determine if any medicines need to be added or reduced. Provocation tests can also take place to diagnose asthma. A provocation test is a lung test that can help identify how sensitive one's lungs are. Some provocation or trigger tests can be used, such as the Irritate Challenge, Exercise Challenge, or Methacholine Challenge. These tests can help confirm whether or not the patient has asthma or rule it out if other lung tests didn't help or give a clear diagnosis. Type of provocation test is an irritant challenge. During an irritant challenge, the doctor will have a patient experience an asthma trigger to see if airways have any sort of reaction to the trigger. Triggers can include smoke, perfume, or other chemicals that are shown in the diagram to the right. After being exposed to the trigger, the patient will take a breathing test to see if there's a response to confirm any asthma triggers or any reactions in the airways. Type of test is an exercise challenge, which is used because some exercises can trigger asthma symptoms. During this test, a patient will run on a treadmill while the heart rate and oxygen levels are being measured and monitored through electrodes placed on the patient's skin. Results can help determine if the patient can have any asthma symptoms occurring during exercise through results shown on an EKG monitor.
Even though asthma is an incurable chronic condition, the prognosis of this disease is generally positive. Asthma can be very well controlled if a proper treatment regimen is followed. Physicians may provide asthmatic patients with different sorts of medications and inhalants, specifically ones that aim to dilate the bronchioles of the lungs and decrease inflammation of the airways. Further, the prognosis of asthmatic patients can severely increase if they acknowledge certain risk factors, like cutting out smoking and refraining from chewing tobacco, both of which worsen asthmatic flare-ups. Another factor that can aid asthmatic patients is recognizing their specific triggers, as shown in the figure on the left. Knowing what particle causes asthmatic patients' flare-ups or attacks can really help the prognosis of these patients. Data has also supported the notion that asthma is a controllable condition with very low mortality rates. In 2009, the mortality rate of asthma in the U.S. was reported to be 1 death per 100,000 persons, signifying a relatively small mortality rate for this condition. Incidences of asthmatic mortality were also associated with the failure to undergo consistent treatment. Therefore, following a treatment regimen is very important for asthmatic patients. There are a wide variety of treatments that doctors may utilize to treat a patient that has asthma. Firstly, they may prescribe bronchodilators that seek to dilate the bronchioles in the lungs. This method of treatment works very well due to the mechanism by which asthma proceeds. The picture on the left demonstrates this mechanism very well. For an asthmatic patient, a specific trigger, including inhalation of particular irritants or allergens, physical exercise, or cold air, can cause their airways to narrow, swell, and produce extra mucus, making it very difficult to breathe properly. In order to combat this, medications that target airway dilation would allow asthma patients to breathe properly once again. Anti-inflammatory medications are also often prescribed in order to combat the swelling that frequently accompanies airway constriction. Lastly, steroids may also be prescribed in the form of inhalers to aid again in airway inflammation for asthmatics. Other treatments for asthma include cutting out certain risk factors that make asthma flare-ups significantly worse. Smoking and chewing tobacco are 2 risk factors that physicians may ask patients to cut out in order to increase the prognosis of this condition. Environmental irritants like pollutants or chemical fumes are also risk factors that tend to make asthma worse. Therefore, if it's possible, it's important for asthmatic patients to limit their exposure to these irritants in order to control their asthma. Lastly, a form of immediate treatment for an asthmatic undergoing an asthma attack would be oxygen supplementation. In the event that medications are not immediately available, providing an asthmatic patient with direct oxygen would allow them to inhale a greater amount of oxygen, helping to curb their asthma attack. In the US, around 25 million individuals suffer from asthma. Generally, asthma tends to be more prevalent in females than males. However, the reason this trend is observed is unknown. Asthma is also more common among children than adults. It is actually the leading chronic disease in children within the United States. The picture on the right demonstrates these U.S. trends throughout the years 2001 to 2009. Around 300 million people suffer from asthma around the world. Every decade, asthma rates have been increasing globally. This is largely due to the increase in urbanization throughout the world. With urbanization comes an increase in air pollution and environmental irritants that serve as triggers that affect the respiratory tract of more and more people. The picture on the left demonstrates the prevalence of asthma around the globe in the year 2017, a trend that has continued to increase both globally and within the U.S.